Social work in the realm of mental health is almost an exclusive role of the clinical practitioner. As such, I'm going to look at postmodernism and modernism and how they apply to social work practice in the clinical setting. I'm going to start by introducing the concept and then give an example of how it's applied in that setting. And then I'll finish up with a little conclusion for your viewing pleasure. Modernism, theory and application. More likely what I'm talking about, and more specifically, is a scientific method. Ivan back in the day suggests that truth is sought for its own sake. Then we have a long history of Socrates and Descartes, the scientific revolution, the father thereof. The scientific method seeks to explain the events of nature in a reproducible way and then make predictions based on its knowledge. So when we look at this stuff, it's kind of reductionist. It looks at double-blind studies, all those important things to ensure objectivity. That's the main component. And so to be able to reproduce this is an anxiety versus depression versus bipolar. We need to know these things so we can treat them well and understand them as an entity onto themselves, and then categorize them and put them in great little books like these. Good day, thanks for making the office today. I'm glad you can make it. Hopefully parking and the rest was okay. It can be a bit of a wreck out there. I'm doing different programs we do. I'll talk a bit about that as I got your history from the intake worker, and that's wonderful. To the next screening part, because part of my job really is to determine what's best for you as far as programming, treatment, and the rest. One of the challenges, obviously, as you can well imagine, is that we got to make sure we're treating the right issue. For example, if it's depression, not anxiety, then we need a different group. For example, we have groups on depression, we have one on anxiety, we have codependency, we have integrated programs, so a number of different things to target the issue to be most beneficial to you. And so we need to know that. The other part is looking at level, if you hit clinical levels or not, because anxiety is important to address, undeniably. We all have anxiety at different times. And looking at your history of some traumatic abuse, family issues, some really crappy things that have happened over time with you, the negative feelings around anxiety would be completely natural. And so we need to determine how to best cope with those and best assist you in dealing with the day-to-day life activities so that you're not negatively impacted by that. So, for example, here's some quick questions. Let's just run through a few of them. Have you ever had repeated attacks, unexpected attacks, during which you are suddenly overcome by intense fear or discomfort for no apparent reason? Or fear of having another panic attack? Okay. What about persistent inappropriate thoughts, impulses, or images that you can't get out of your mind? Okay. What about distinct, and this is just simply yes or no, right? Distinct and ongoing fear of social situations involving unfamiliar people. All right. Excessive worrying about a number of events or daily activities. Okay. And there's a bunch more we can go through here. It seems that you'd hit the clinical levels for anxiety, and we talked about medication. There's some really good stuff out there that will help with that and manage those issues. And then look at doing some groups that really target the anxiety issues and how to reduce the symptoms involved in that. And then what we'll do is we'll do some assessment, we'll follow up, see how the treatment plan's going. Maybe we need to change the meds or the groups or what have you. And so I look forward to work with you on this issue. Postmodernism, theory and application. Unlike the predecessor in modernism, postmodernism denies that we can objectively know anything. Foucault was big on this, if you ever saw him with Chomsky debating, especially given the human complexity and diversity, combined with the understanding that things are socially constructed, particularly medicine and mental health. There's different ideas across cultures and places. And to define things as anxiety only being anxiety, and this is it, for example, is difficult. And that's not hard to see when we have SSRIs prescribed for depression and anxiety. So they looks at the polyvocal of understanding of differences in people and where these meet together. Not necessarily just one item at a time, but where they all fit from a holistic perspective. And it's been a new emerging area in social work trying to define that in a clinical setting. Thanks for the cup of coffee, appreciate that. wonderful to meet you. I got a quick idea of kind of what's happening in your life. Seems like there's been a whole bunch of horrible things that have happened to you, from traumatic stuff to family issues. And the result seems to be some anxiety. I want to explore that with you and see how I can be beneficial, because truly, you're the expert on you. If I know more about you than you do, that's a serious mental health issue. And I don't think that's where we're at. And a number of these issues, for example, with anxiety, it's important to look at how they intersect with your life. Through the stories that you tell yourself, for example. And so how the problems affected your life and the meaning that you have attached to it is important. There are some things we can do about some events, and I can look at being an advocate in that role as far as other systems to make your life easier, because sometimes the systems aren't that helpful, not just the mental health system, but healthcare in general, employment, transit system isn't always the best fit for us. So look at what we can do about that, and how you see it and author it in your own story, and try to change that story a bit, because you've done some wonderful things to survive all this and make it here. I applaud you for that. I think that's a wonderful thing. Nonetheless, I think there's things to look at that try to reduce some of them symptoms and see how we can change some of the other more macro issues that might be affecting that. And again, as an advocate, that's part of my role. But again, you're the expert. So let's sit down, have a discussion about what's happened over time, and look at the real reality, for lack of a better term, of why you have some of these feelings, because some of them are very valid, and we can medicate them. That might be an option that we'll look at. There's also other things we can do prior to needing medication that can be just as helpful. And so we can do some mind-body stuff and look at some more eating and health and those general things, and supportive systems with family. What else can we do there? Like, all those things combined will help us try to figure out where this all fits, because my reality isn't your reality, and everybody has a unique and wonderful life that we need to assist and support. So in conclusion, the postmodern versus modernist idea is not a false dichotomy, but both are needed. The human experience is far too complex to put into little ticky boxes of disorders and orders and natural stuff, and to separate itself from the socially constructed ideas that they're built in. It's a bit much for that. But at the same time, we need to measure and look at trying to understand that the best we can. When you look at some other things, the smaller we get into understanding something like quantum physics, we understand the more we don't know. So it's important to have the two together to complement each other, because looking at the trees, you miss the forest, and the forest, you have nothing but a bunch of dead beetle trees.